So, Reese, I understand that you've used this low code technology to build a preventative health application with the intention of helping people to stay healthier for longer in the community so that they don't end up needing to go to hospital, and thereby reducing the burden on the NHS. Could you talk a little bit about the ideas behind preventative healthcare and describe the route that led you to Appian as a solution for your build?
Yeah, certainly. Thanks very much for that. So just to describe to you what we've actually tried to create, I worked in the NHS on a day-to-day basis. You know, it was obvious to me what the problems were at the coalface. So we didn't have the hospital beds, we suddenly didn't have the staff, and there's no more money left in the pot. But how do you do better from that? You know, but there's also strategic issues with how the NHS is run as well as those problems as well, which is, you know, although we call it a health service, it's not a health service, it's a sickness service. It works on a just-in-time basis that you get sick and everybody hopes that the NHS is going to be there to make them better. The problem with that is that the outcome from that type of model is really poor. Even if you are running a just-in-time service and the oil tanker is there ready to put the oil back in the system again. Obviously, that doesn't happen anymore. But even if the just-in-time service does work, the outcome from waiting till people are actually sick to treat them to make them better is a very poor one. And we've known this for 70 years since the NHS was created, but it's the best we could do. You know? Now, a much better model to do is a preventative service to stop people getting sick before they're sick. And, you know, this is something, it's like looking for the Holy Grail. You know, everybody's been trying to be able to do this since the start, but it takes a lot of time and effort to be able to do it. You know? But now with technology and Appian, it's actually possible, and I'll go into sort of why. But the other strategic problem with the NHS is that you've got the NHS service and you've got the local authority with a social care service. And they're dealing with the same people, but they don't talk to each other. You know? And they can't talk to each other because they're paid differently from different pots of cash and run by two completely different services with then ultimately different ethoses about how to run and organise the services. So we decided to try and break down all those barriers with this one application which we've created in Appian. And we found Appian was fantastic for this because it gives us speed to creativity to sort of landing your idea in the market. It's just incredible, you know. You can't compete, nobody can compete with that, you know. To be able to go into that Lego box of Appian, grab the widget you want, plonk it together, and all of a sudden you've got something that works. That was one of the first things that we really needed, especially as a startup company ourselves as well. You know? But the second thing is that, you know, you've got the security of Appian. You know, Appian is used by military, it's used by governments. It's incredibly secure. So it gives us a huge reassurance to anybody that's working with us that, you know, hey, your data is safe with us, you know, which in this day and age, I think you've just got to have, you know, and, you know, no matter how good your programming is, you know, you've got vulnerabilities, you've got weaknesses, you know, at least I can offload that problem to Appian, and I know they've got that covered for me, you know, so, but going back to our solution, yes, so this is what we've done. We've gone to try and recreate the health service, you know, to a health service, you know, and we've based that on, the first thing is prevention, but the second thing is on personal responsibility. And people have got to understand now, actually, the health is their own responsibility, not somebody else's, and somebody else's might not necessarily save their life if it comes to it. So those are the two things really, but by embracing both of those together, the prevention piece and the personal responsibility piece, you know, using our technology and to be able to do this, all of a sudden it makes everything that was been totally impossible for the last 70 years now possible.